And we're back talking about that US-Kenya health deal that was signed in Washington just recently. Let's get into the issues with you, Waziri, now about the issue of data that is being shared. What data exactly is going to be shared in this deal?
Number one, I think we are better off now. Before this deal, before this cooperation framework, health cooperation framework, our data was fragmented, our data was everywhere. It was with the donors. They were collecting data on HIV, on TB, on malaria. They were sharing with their donors. We had no oversight, we had no control. And you know, before this G2G, and we'll still work with the US CDC, the Walter Reed University, the American Defense. So now we have, as a country, I am proud to say that we have a very robust legislative safeguards to protect our data, not only on this deal, but only. And if you look at that document, we have anchored our sharing of our data on health matters within this ecosystem, on the Data Protection Act of 2019, on the Health Act, on DHA, and nothing will get out of it. And if you read deeply, it even says the people to provide the data, the people to give the access, the people to share the data is Kenyans.
Okay, but first,
yes,
what data exactly is being shared?
Mainly the data we are sharing are data within the health sector. And we are not sharing data of individuals. There's something called the identified data. In this document, you'll see it. The identified data means data that don't have personal data. Doesn't have the address, doesn't have the name, doesn't have the location, doesn't know the person. In terms of, are we sharing the data? Is it the data on our HIV prevalence, on TB, on malaria? Then we have something called aggregated data. And aggregate data is a combination of data, patterns of how. And that's why sometimes we release county by county.
Okay, but what data? What is it that you're sharing?
No, I'm
Fine,
saying,
you said it's de-identified.
Yes, I'm saying,
does not. But
I'm saying,
what is it?
I'm
saying
any data within the 4 areas that I have told you within the framework of this cooperation. For example, let's
give me an example.
Let me give you an example of HIV data. What is the preference rate? How many Kenyans are using ARVs? Okay? How many Kenyans are dying of TB? In this document, in the main framework, you see there are close to about 5,321 Kenyans who die of TB. And by 2030, we anticipate, because of this huge investment, that will reduce to about less than 1,200. So those are the aggregate data that we share with the country.
Okay.
Health data.
Why are you sharing
And I'll give you a good
data?
example.
Okay, why are you sharing this data with the US government?
No, I'm telling you, this data is very shared with the World Health Organization. It's a global thing.
That's fine. I'm just asking why we're sharing it with the US. We'll talk about global the day you're here talking about that.
Let me ask you, even before, in fact, now we are in charge of our data. Even before, during the USAID, many of these donors had their own data. Nobody was checking, nobody was oversighting, and they were sharing.
All right.
Yes.
Be that as it may, Waziri.
Yes.
My question is, why are we sharing this data with the US? What
Data?
for?
Data is a global phenomenon.
So what is the US going to do with this data?
No, let me ask you. In terms of the health component, the US has better laboratories. The US has the most surveillance systems. They learn from us, we learn from them. And it's not only Kenya. If you go to WHO, for example, data of the African continent is given. The data of the whole world is given on HIV prevalence. That's why, what does UNAIDS does? UNAIDS does all the aid, the data on HIV prevalence, ARV, how many people on it?
Okay.
The age group.
Still,
Yes.
the question is, per this agreement, because they're giving over 200 billion.
Let me ask you. Let me even take you another way.
Kenyans want to understand this. Let's just understand, for what purpose is the US going to use the data that the Kenya government is sharing?
For what purpose? What purpose were they using before?
Tell me, Waziri.
No, I'm telling you, they had USAID, which was heavily funding.
Which you have said.
No, let me ask you.
Which USAID you have said you are discounting the work that they've done. You've said they were not using the data. This is an agreement, Waziri, that the Kenya government
I did
has
say
signed.
they're not using the data.
Well, but you said you didn't have control or oversight over
Yes.
it, right? Now you have control or oversight over the data, yes?
Yes.
For this agreement.
Yes.
And as part of control and oversight for that data, you would know what the US government is
Okay, let
going
me
to
give
do
you an
with this
example
data.
why we share.
It's a simple question, Waziri. What are they going to do with the data?
Let me give you the reason why we want to share with the data with the US, particularly in this framework. Okay? We have become partners. Okay? They are our co-investors. We plan with their resources. We monitor, we evaluate. Okay? If we have invested in HIV, for example, through NASCOP, HIV, TB, malaria, we will invest them through NASCOP, particularly HIV and TB. Now, for us and them to know the investment we've made in this sector of our health, what are the indicators? What are the data? These are basic data. What are the indicators? We are buying commodities. We are scaling our laboratories. We are dealing with surveillance and epidemics in our region, in our country, through the Kenya National Public Health Institute. Those institutions, basically, NASCOP deals with scientific data. And that scientific data is a data that we share with the people of Kenya, that we share with our partners, that we share with global institutions like WHO, like UNAIDS. That is how data is shared. But that's why I told you, the fear that Kenyans have is, do we share their individual personal data?
The other fear,
that has been insulated in this agreement.
The other fear, Waziri, is basically because data is big business and data is important. So we can talk about data is important. Is it not?
Of course, data is important.
Good. All right.
You use data to plan.
Okay. So they will be using our data to plan for what exactly? Considering the data sharing agreement outlasts this cooperation framework of 5 years. So they're getting access to our data for 7 years, correct?
Yvonne, let me make it very clear. I think we are missing the point. We have invested 200, in our agreement, we've invested 210 billion or 1.6 billion US dollars. Okay? We're not investing in a bank. We're investing in the health system of the Republic of Kenya. These resources we're investing and this human capital we're investing, in this security commodity we're investing, and in the disease surveillance we are investing, and upscaling of our laboratories, we must get data to show where we are. What is evaluation and monitoring? If you buy commodities, for example, for the people who are on ARVs, for you to plan logistically, you must have the data. So at the end of the 5 years, and the Kenya government is transiting and taking over at this sustainable healthcare, the whole thing we're doing in the ecosystem, the baseline is data. I will give you a good example. We have 27.8 million Kenyans who register. We can aggregate them into gender, into county, into age group. That is data.
And will there be any benefits that the US government will accrue from this data?
Not only for the US, for us, for them,
Okay.
For research.
But for them.
For research.
For research.
For research, and I'll give you a good example. We might use a certain particular drug on a particular disease, and we might find what is the resistance level, what is the efficacy level. Those are data.
So
all that, the Data Protection Act, which was passed in 2019 when I was the leader of majority, and the Digital Health of 2013 have put enough safeguards to protect the individual personal data of our citizens.
Noted. My question is, will there be any benefits that are arising thereof? Like you said, some of the data will be used for research to determine, for instance, efficacy of certain drugs. If there are any benefits that they accrue from that, say, for instance, based on usage of certain drugs in this country, allow me to finish.
Yes.
And then they then use that research and improve the efficacy of the drugs, that's a benefit on them because the drugs are being produced by the American government, right?
Yes.
So they use our research data to improve the efficacy of their drugs.
In fact, most pharmaceutical companies in the world. Let me give you an example.
No,
not even the Americans.
I want us to talk about this particular framework agreement.
Okay, let me pick.
So no, let's just go step by step. So if there are any benefits that they accrue from, these drugs from our data, and they're able to improve the efficacy of their drugs, at what point is any of that benefit shared with Kenyans? Because that benefit is accrued from the use of Kenyan data.
The people who are employed as researchers in this cooperation agreement, our epidemiologists, about 500 of them, are the ones who are doing the research. The training that is taking place is training of our people. And many of them, you'll see them working in CDC Atlanta. But, I'll give a very good example. Now our prevalence HIV rate is about 72%. 92%. We anticipate by 2030 to be at about 99%. That is data. That's the strategy we're using in this framework. Same for TB, same for malaria. The labs that now we use to test some of the epidemics that happens even within the region, we don't have the safety labs standards. We send them to South Africa. We send them to Atlanta CDC. We send them to other countries. This agreement will help us upscale our BL labs in our country, both at our county levels and at the national level. And if you look at the key institutions in this agreement, are MOH, Kenya government institutions. When it comes to HIV, AIDS, and TB, you're talking of NASCOP, will lead. When you talk about disease surveillance and emergency response, you're talking, and the people will be trained, you're talking about the Kenya National Public Health Institute. When you talk about integration of some of these ailments, the TB and HIV, into the primary health care, you're talking about SHA. When you talk about protecting our data, you're bringing in the DHA that will amalgamate all the systems which were before run by donors. And I think if you talk about commodity security, then you're dealing with KEMSA. So this is how this agreement is framed.
So the reason I ask that is because in the data sharing agreement that you have provided here, it says all benefits obtained based on insights derived from data provided shall require entering into other subsidiary agreements. So any benefit that accrues from that is then subject once again to other agreements? Let me give you an example. Yes. In section 25813, it talks about some of the benefits include such as monitoring the uptake and performance of lenacapavir.
Yes.
Which is a US-approved drug for HIV.
Yes.
So my question is, this is an American drug.
Absolutely.
Produced by Americans.
Yes.
Not by Kenyans.
Yes.
If from the data that is shared, they're able to improve the performance of this drug, of what benefit is this to Kenyans? Because this is a drug we're buying anyway.
And are you aware, Yvonne, that 90%, even 95% of the vaccines that we give to our children, not only in Kenya, in Africa, are imported. Are you aware 70% of the pharmaceutical products we consume in our country are from outside? And that's why President William Ruto now is a champion of local manufacturing in Africa. That we must reach a stage as a country that at least 70% of the drugs that come to our country, I mean, that are consumed by our citizens, are drugs that are manufactured in our country.
And
so why are you very much bothered about if we get...
Because there's the concern around the world
about
Big Pharma and the fact that they use data to produce drugs. Those drugs are then sold back to Kenyans. I mean, some would ask if the information that we provide to the US government enables them to better the efficacy of, say, lenacapavir, then shouldn't we be part of the benefits of that drug? For instance, would it be subsidized to the Kenyan government, considering it's our data that has helped improve the efficacy?
Why are you not asking that then at the same time we should pay the 210 billion we should share? But let me say this.
So they're paying
big pharma companies. I am talking to them, by the way. And the first one I've had an MOU with, Roche International. Roche International make a drug called Herceptin. It is used for breast and cervix cancer. Before I came to the ministry, it was being sold at 120,000 a session. Today, after we did an MOU, and they realized that the margin, the profit margin was crazy, today it's sold at 40,000. We are talking to Pfizer, an American company, that provides majority of the essential drugs that we consume in our country. Because we realized the cost of drugs is an issue in our country, and the quality of drugs. I'm sure you've shown, whether it was your station, you've shown about this member for Mosop, I think Mosop, Kirwa, who got a stroke and then he was given the wrong drug, as he's alleging, and then he was taken to the US. And he's back and he's really clean, and I think he should go to the Pharmacy and Poison Board. So we are living in a global village, okay? Particularly in the healthcare ecosystem. This deal has never happened since independence. This deal has happened during a time when we're doing very, very serious health reforms in our country. When we're making sure access to healthcare is equitable, is affordable, is universal, and there's the element of equity.
All right. Let's talk about how this agreement is founded. Is it what one would call a legally binding agreement? In the sense that if there is a dispute between any of the parties, how would that be resolved?
It is there.
Tell us, because for my viewers who can't see it.
Each party, number one, there's something very interesting you didn't say. This agreement, particularly the data sharing, is anchored in our laws. And in the event there will be a conflict between the two laws of these two countries, the Kenyan law supersedes. Okay? In the event either party or participant wants to walk out of this agreement, it will give the other 6 months in writing so that they can call it a day.
But it does say it must be done by mutual consent.
Of course. Every agreement is a standard procedure.
And here's the thing. So resolution of differences, according to this, says that any resolution of differences will occur through consultations and negotiations through diplomatic channels.
Yes.
There's Kenyans who think this is a weak agreement or a weak proposal in this agreement and that it is not legally binding. Let me ask in this case an example, for instance. If you find there's been a breach of conduct, say of how the data is used, or the conduct of any, because it's a government-to-government deal, right? But you have got government officials of both the United States and Kenya working on the deal. If you find that there's been any breach in this agreement, the question that some ask is, how is then that resolved, and what is some of the remedies that will be provided to Kenyans if you find that on the part of the U.S. citizens?
It is. Not only the U.S. citizens. Even if a breach is found on the part of a Kenyan provider, the consequences are in the agreement.
Which is?
I thought.
No. Not all. Waziri, you're not here to. I've read this agreement.
You know the Kenyans you're talking about.
Not all of them have read the agreement. That's why I'm asking you to. You're here to answer the question.
No, I'm here to answer.
Great.
Serious questions, not pedestrian questions.
Okay.
Or hypothetical questions.
But these are issues that could happen.
You know, hypothetical questions.
Do the U.S. personnel or contractors in this deal, do they enjoy diplomatic immunity?
No.
They do not. So they would be subject to which laws?
Both the U.S. and the Kenyan laws. When they're in Kenya, they will be... The whole of this document, from page 1 to last page, is subject to our data laws, the Data Protection, the Health Act, and the Digital Health. And that is why I made this thing public. I know what I'm doing. I mean, data asset, in my opinion, is a national security matter. And that is why when we were crafting this document, we were not pedestrian. We knew what we were doing.
So, you're here to answer questions.
Yeah, I've answered your
right?
question.
So, otherwise, you'd have just put it on there, and not everybody.
No, I have done it yesterday. By the way, I have done it yesterday. I am only trying to explain.
Yes.
No, we have a duty as government, we have a duty as leaders to make sure that we answer each and every question the citizens of our country ask. And that's why I'm here. And I'll not only stop here, I will answer these questions. Not me, my colleagues will answer in the ministry. Our technical team will answer.
So the question on why they get the data, access to the data for 7 years, when the agreement ends in 5?
No, what we have, even if you look at this agreement, when the stopgap order was made by President Trump, a lot of Kenyans lost their jobs. So before we agreed on this agreement, we agreed on a transition period, okay? So that from the time the stop-up order was given to March of next year, still the implementing agencies will complete what is remaining. We will take over from March. In fact, KEMSA will take on a later date, because we're doing a lot of reforms within KEMSA, in terms of refill rate, in terms of governance structure. So the question you are asking me is that, what did you ask me?
Access to data that is granted for 7 years, while the agreement is 5 years.
In fact, they wanted 20 years, they wanted 15 years, they wanted 10 years. We are the ones who pegged it on 7 years, because data cannot be collected today and given out tomorrow. Data collection, data aggregate takes a period. So if it is our 5 years, data takes a longer period, and that's why we have given them an extra 2 years.
Data takes a longer period?
Yes.
How so? Please explain that.
To analyze a data is not an instant coffee.
How long does that take?
Buying commodities and collecting data, analyzing them, taking them to the labs, take years. You can go to Cambridge, our biggest research institution, or Wellcome Trust.
I want us to take a couple of questions from those who are joining us.
I am ready.
Here's one. What personal accountability measures are you prepared to take if public health resources are diverted or transparency commitments are breached?
On the part of the Kenya government? Yeah?
Yes.
Yeah, yes.
Yes, Waziri, because you work for the government. Yes.
Yeah, let me speak. As long as I'm the Minister for Health, I took an oath to protect public resources. Kenyans will help me to account as the top leadership and the government. Minister of Health will never be again the famous COVID billionaires and all that. And I'm sure the last 7 months, the men and women who I work with and the country knows, I will protect not only these 210 billion, I will protect both the Kenyan taxpayers' money and the American taxpayers' money, or any other donor who want to come and support in building a resilient health system and sustainable one in our country.
Regarding sustainability of the fund, because in a certain...
I saw a leader saying, oh, they're going to steal the money. You know, the problem is there are too many people who talk very pedestrian in our country. People must have a very healthy, educative conversation so that the people watching us can judge.
Let's take questions from those viewers who are watching us now. And here we are. Al-Haj Abdul says, it's great to hear about the U.S. health support, but with past funds like SHA money still missing, how will Kenya know this money is safe? How will Kenyans know this money is safe?
SHA money is missing.
Sorry?
We have dealt with the fraud. We have over 13 billions. We have our system, our digital health superhighway AI fraud engine has detected, both in public, private, and faith-based institutions. Many have been taken to court, including staff of SHA in the last 3 months. So I am making sure that every penny that Kenyans pay, money belonging to Kenyan patients, it's immoral, it's unethical, it's unconstitutional to make one wealthy. That will not happen. So there's no SHA which money has been stolen. In fact, to the contrary, it is facilities that are stealing the money that belongs to Kenya, that SHA is the custodian.
All right. Just to get another one here. So, Agri Adero from Mombasa says, will Americans also be sharing their data as well, or is it only Kenyans?
Of course, there are many Kenyans who work in Walter Reed and CDC. I'll tell them to go to Atlanta. There are more than 3 dozen Kenyans working there, and I am so proud of them. In their labs.
No, the question was...
Of course, the data... What
are Americans going to share their data with Kenyans?
Yes.
Where is that in the agreement?
Yeah, read the agreement.
Where is it?
It is in one of the articles. Both countries will share data.
So what data are we going to be getting from them?
Health data.
What health data specifically?
Whether it is disease surveillance, if there's an outbreak in one of the regional countries, if our colleagues, the Americans, CDC finds out, they'll share that data within 7 days. They will detect within 7 days. They will notify us within 1 day, and action will be taken within 7 days. It's called 717.
So they will also be equally sharing their data with us?
They have the capacity.
Of their...
they have bigger capacity.
Of their HIV prevalence rates?
Yes.
Malaria and others? Yes. They will be sharing that data with...
They will do research.
Okay. And what will Kenya do with that data?
Let me give you a good example. The CDC presence in Western Kenya, in Kisumu, is amazing. They do a lot of data they share with us. The Kemri Wellcome Trust research centers in Kilifi share data and train Kenyan scientists and researchers. Kenya is a leader in healthcare system. We are number 2. Are you aware of that?
All right.
In Africa.
I want to go back to...
And we must be proud of.
I want to go back to something
and today, by the way, even WHO has recommended, many countries want to learn how we are implementing universal health care. Many ministers are writing to me.
So, per this agreement, before we continue with viewer feedback, because I'm just reading through it, this is the cooperation framework.
Yes.
When I asked you earlier, Waziri, about...
It's a legal document.
Okay. When I asked you...
Both of us are not lawyers.
When I asked
but I am ready to answer because I read page by page.
Okay. So when I asked you earlier about privileges, do any of the workers enjoy any privileges? You said they do not.
Which workers now?
U.S. workers who would be dealing with this, who would be involved in this deal.
You asked me about immunity. They don't enjoy diplomatic immunity.
Okay. Paragraph 12 says nothing in this framework should be interpreted or construed as a waiver of the privileges, immunities, and facilities which each of the participants enjoys by virtue of the international agreements and laws applicable to each participant. So essentially that's saying nothing should be construed as a waiver of immunity.
Let me tell you.
And therefore the immunities stand?
USAID was a different entity. It was like a ministry in the Biden administration or in the other previous administration. What we are dealing now, the replacement of USAID is called America First Global Health Strategy, domicile at the State Department. Domicile at State Department is the equivalent of the foreign policy arm of the U.S. government.
Yeah.
In the event any official wants to visit Kenya and to work with us just to see on how progress we're making, including Secretary of State Rubio or the other gentlemen who are diplomats in State Department. Just like the way Musalia Mudavadi goes to the U.S., they will get some diplomatic reception.
But
immunity.
Which was the original intent of the question.
They will get reception.
They will get what?
Diplomatic reception. Yes,
but on the issue of immunities of these parties, nothing in this agreement, and this is both in the data sharing agreement, Article 5, and in paragraph 12 of the cooperation framework.
You should read this. You should read this data.
Not even the data. Even in the cooperation framework, again here, paragraph 12 says that nothing in this framework should be interpreted or misconstrued or construed as a waiver of privileges and immunities. And the question that some would ask of that is it is biased in the sense that should there be any wrongdoing or any breach on any part of any of those, that they will continue to enjoy diplomatic immunity as is, international law to which both parties have agreed to?
For you to enjoy diplomatic immunity in a host country like Kenya, it's a different ballgame. The minister or the CS for Foreign Affairs must table before cabinet that this institution, these persons will enjoy diplomatic waiver.
So if any of those entities then mishandles any of the data, or there's any breach of any kind, maybe not even necessarily, maybe not even necessarily with the data aspect, the question is, what will happen if they continue? It could be any of the entities within the Ministry of Health. It could be any of the entities within the Secretary of State.
Number one, this agreement, the planner, the executor, the person who makes sure it's done, it's the government of Kenya, the Ministry of Health, and its agencies. The role of the U.S. government is one. The role of U.S. government is to make sure that funds and the parameters and achievement that were meant for this within the healthcare ecosystem are achieved. So this is in the budget. It's planned by Kenya government through the Ministry of Health, executed by the Ministry of Health.
Who have contractors, who have personnel?
No. We have no contractors.
Personnel?
No, we have no personnel.
So there are no personnel?
There are no
so who's dealing with this? I mean, there are people who are actually implementing the deal, right?
I told you, if it is TB and HIV, NASCOP will deal with it.
Okay.
If it is surveillance and epidemic emergency response, it's Kenya National Public Health Institute.
My question,
if
Waziri, if it is NASCOP,
you told me to finish.
Is a NASCOP done by individuals?
NASCOP is...
Don't individuals work for NASCOP?
Individuals, Kenyan individuals.
Good. What about on the other
side? But I've not finished.
American
no,
side?
You should allow me to finish because you have allowed you to finish.
All right.
If it is community security, it is KEMSA. If it is digital health agency, making sure data is protected, it's the data protection and the DHA. If it is, the other element was on healthcare workforce, it is the Department of Standards and Professionals within the Ministry of Health. It's Kenyans who are in the implementing partners. For many years, NGOs and Western implementing partners were the custodian of these $7 billion US. And that's why you saw Secretary of State, it's not me, he used for the first time a very important word. He said, we will not be, or we will not allow to build NGO industrial complex under President Trump. And I really want to thank both President Ruto and President Trump that Kenya is the first country out of about 50-something countries globally who in the next 1 month maybe will sign, if they are ready, to do government to government. It never happened in any of our previous government. They used to come to our country, collect data, do everything they want, but now we are in control of our resilient healthcare system in our country.
All right.
And Kenyans should be proud of that.
Okay, let's take the final questions, comments. All right, okay, let's do that. Here we are from Honorable Elder Davy. You say there's no way, quote, our partners can invest such a huge sum of money to get data without a target. You mean no one in our government asked the question, why the data, red flag? And then Jack, you'll get a moment afterwards.
Yes.
Let's just read this together. Jack says, data must be shared to be sure the money is serving the intended purpose. Nikikupa 500 utumie, you must account so that I give you more. UHC SHA is working. And then, so those are the two comments.
So my question to, why are they giving us 210 billion? Why did they give, why are they not, Kenya not asking why they gave $7 billion US to USAID and Western NGOs and local NGOs who we had no control over? Why are you questioning the 210 that is coming to your government that you have elected? And you are not questioning what was their interest when you were given $7 billion US the last 10 years, during President Kenyatta, during President Mwai Kibaki. You did not question. I mean, your questioning is very pedestrian.
So we shouldn't ask questions about this deal?
No. I can only ask questions that are of value to the people of Kenya. Mm-hmm. I don't want to answer pedestrian and fake related questions. I mean, they're negative forces. I mean, I'll tell you, I am not the type who will allow my mind to be the dustbin of negative people. We need, we need to engage constructively in a show like this with the good questions you're asking so that many Kenyans can ask. When you ask me, what is the interest of these the 210 billion? When I was a defense minister, we have a huge defense cooperation agreement with the US government. I secured $56 million US in the expansion of the Manda Bay to secure our country from terrorists. We are building, they've invested in the National Defense College. We have a huge security. We have a huge investment in trade, AGOA. So why is the 210 billion that will help our Kenyans who are suffering from HIV, from TB, from malaria, protect our country from epidemics, both within our country and in the region, making sure KEMSA has the logistics, has the commodity, each and every dispenser in our country has the required drugs, because the question now is there are no drugs. That Kenyans should be very happy that their country is the first one. We are not the type of people to sell our country. But the question I've asked you is, if your question is 210, then you should also question the 7 billion that was going to some amorphous NGOs and some in Washington, D.C., that Senator Rubio called it the NGO industrial complex. That's how the world should go.
Okay.
Because let me finish this.
Yes, we have to close.
Government has taken an oath. The president has taken an oath to protect his citizens. Am I right? If the data is used, I will be held responsible. So we are better off now than an NGO that we are not accountable to. You can't call them. They don't follow the Data Protection Act. They don't follow the DHA, the Digital Health Act.
So you're saying you will take personal responsibility?
Oh,
Should there
yes.
be any breaches?
Yes, I have given this document to you. I have given to Parliament.
Okay.
I am ready to face anybody. I took an oath. The president took an oath. There's no way the president can stand behind us as we sign.
Let's leave it there, Waziri. Thank you very much.
Thank you very much,
here
Yvonne.
with us on the show, on the program, to discuss this deal in 90 days. This should be, operational?
Yes, we're not just doing the transition.
Okay. All right, in 90 days. We shall continue to ask the questions that need to be asked. Thank
Tonight,
you.
I am sure our patients, HIV, TB, malaria, cancer, disease surveillance, our country will be more safer. And I will account for each and every shilling. I want to assure the people of Kenya that.
Okay. Let's leave it at that assurance.
Thank you.
We shall hold you to that, Waziri. Thanks very much
for
being with us. CS for Health, Aden Duale, speaking to us about that deal signed between the Kenya government and the US government. Let's take a break. We have more news for you when we return here on The Explainer. Rate cut number 9. Central Bank reduces the base lending rate in its final monetary policy meeting of the year.